Hello ladies and gentlemen, my name is Josh Fuller, and I'm here today to talk about pyloric stenosis. Expecting parents know that there are many things, medical conditions, and diseases that can affect the health of their child. They try to know as much as they can about the diseases and conditions in order to protect their child as best they can. Some of these things can be prevented or treated, and some of them cannot. But a relatively common and yet very serious condition known as pyloric stenosis is something that very few people actually know about. So, pyloric stenosis is a condition that mainly affects newborns, and it is fatal if not treated within the first few months of life. It is very important to me because it runs in my family. I've known at least 3 family members in the past 2 generations that have been affected by this condition. This includes my uncle, who died from it in 1950, and both my father and myself. I actually got my middle name from my uncle who passed away from it. So, let's look at what's to come. We're going to take a look at what pyloric stenosis is, the side effects of pyloric stenosis, who it most commonly affects and your chances of getting it, the diagnosis of pyloric stenosis, and as well as correcting pyloric stenosis. To understand the severity, you must first understand what pyloric stenosis is. So, the technical definition of pyloric stenosis, according to MD Michael Irish on his website, says this: pyloric stenosis involves hypertrophy of circular muscle of the pylorus, resulting in a narrowing and obstruction of the pyloric channel by compression of longitudinal folds of the mucosa. So what in the world does this definition mean? Well, it's actually fairly simple. As you can see from this drawing, the pyloric muscle is right here, and it actually compresses the intestines right there so that the food cannot go from the stomach into the intestines and be digested properly. So what does this cause? First of all, it causes projectile vomiting. It's the most common way to diagnose pyloric stenosis. Whereas most babies will just dribble food out of their mouth, they won't be able to digest anything, so they will actually projectile vomit because nothing can get into their intestines. Other side effects of this condition are malnutrition, dehydration, acid-base disorders, and of course, it is fatal if not treated. This is very important to remember because you want to pay attention to the side effects of pyloric stenosis so that you will know if your child has it. It is also important to understand who pyloric stenosis affects and your chances of getting it. So, pyloric stenosis mainly affects infants. We will talk about this in more details shortly. It is also hereditary. Obviously, I have personal proof of this because it has run in my family between both my uncle, my father, and myself. There is also a study done by Camilla Crowe in her article, Family Aggregation and Heritability of Pyloric Stenosis from 2010, and it concluded that pyloric stenosis shows strong family aggregation and heritability based on their research. Gender also plays a major role in pyloric stenosis, as males are 4 times more likely to get pyloric stenosis than females. Ethnicity is also a major role. It is mainly found in whites of Northern European descent. It is sometimes seen in blacks, and very few cases have been involved in Asians, in anybody from Asia. There is also more studies still being done on pyloric stenosis to determine if there are environmental factors that affect pyloric stenosis. These could include breastfeeding or the position that the baby sleeps in. Because pyloric stenosis mainly affects infants, let's take a closer look at that. The following information is from Phi Huang in his article, Infantile Hypertrophic Pyloric Stenosis Before 3 Weeks of Age in Infants and Preterm Babies from 2010. Pyloric stenosis is usually diagnosed in the first 3 to 12 weeks after birth. It is rarely seen past 6 months, and the average diagnosis is at 40 days. Remember, this is fatal if not treated because the baby cannot process their food, so it is important to correct it as soon as it is diagnosed. There is also surgery complications from pyloric stenosis, and even though this is a fairly common practice for doctors now, there is always risk in surgery when you're dealing with infants. We know pyloric stenosis can be fatal, so what does it take in order to correct and detect it? First of all, in order to diagnose pyloric stenosis, you want to know about your family history. If it runs in your family, you need to take extra precautions in paying attention to the side effects of pyloric stenosis. Also, if you're unsure in any way, be sure to get an ultrasound, as ultimately that's the way to tell. So, correcting pyloric stenosis. The procedure is called pyloromyotomy. According to Dr. Eddie Chang in his article, Infantile Hypertrophic Pyloric Stenosis, Genes and Environment from 2008, pyloric stenosis is the most common condition requiring surgery of people under a year old. The procedure is usually done around 2 months of age, and it requires a small incision in the pyloric muscle. The good thing about pyloric stenosis is that it is a one-time procedure, and once it's cured, you should never have to worry about it again. This information on pyloromyotomy can be found in the Mosby Medical Encyclopedia 2005. In conclusion, pyloric stenosis is the most common surgically treated condition, and it's very important to understand what it is, how to detect it, and how to correct it. The consequences could be fatal to your child if you're not paying attention. It is also important to realize that gender, ethnicity, and family history all play a major role in pyloric stenosis. By being aware of the possible diseases and conditions that can affect your child, you can be more prepared to deal with them when they come. The more you know about medical conditions, the better off you will be to detect and correct them before they become a significant problem. Thank you, ladies and gentlemen.